Gentlemen, let me ask you a question most men think about but rarely say out loud. What really happens if you ejaculate every single day? Is it healthy? Is it harmful? Could it improve your performance or quietly drain your energy over time? If you've ever wondered about this, you're not alone. I hear this question constantly in my clinic from men of all ages. It's one of those topics that stays in the shadows, half whispers, myths, even guilt. And yet, it's at the heart of men's health, relationships, and confidence. Today, we're breaking that silence. But first, tell me in the comments, where are you watching from today? I love seeing this community grow around the world. And while you're down there, hit that like button and subscribe, because each week we talk honestly about men's health topics that most people avoid. Now, let's clear up the biggest misunderstanding right away. There is no universal answer. Ejaculating daily isn't automatically good, and it isn't automatically bad. It depends on why you're doing it, how you're doing it, and what effect it's having on your body and mind. Some men feel great with a daily release, better sleep, less stress, more confidence. Others may find that it increases their desire, drains their energy, or even causes performance issues over time. So the truth isn't black and white. It's about context, your biology, your habits, and your life stage. Now, let me reassure you, if you felt unsure about this, it's not because you're ignorant. Most men were never taught how their bodies truly work when it comes to sexual health. That's why I've made it my mission after more than 10 years as a board-certified urologist to break down complex science into simple, practical advice you can use every day. I'm Dr. Jodie Whittaker, and I've spent over a decade helping men in their 40s, 60s, and even 80s take charge of their sexual and overall health. Think of this conversation as doctor to friend. My job is to help you understand what's happening in your body so you can make smart choices, not live by myths or fear. So today, I'm going to give you the full picture, the 5 surprising benefits of ejaculating daily, the 5 possible drawbacks you need to watch out for, and most importantly, how to know what's right for your body, your goals, and your health. By the end, you'll feel confident, informed, and clear, without shame, without guesswork. Now, let's get into it. Benefit number 1, pleasure hormones and mood control. Ever notice how calm you feel afterward? That's not your imagination. When you ejaculate, your brain releases a powerful mix of chemicals. Biologically, here's what happens. Endorphins, your body's natural painkillers. Dopamine, the reward chemical that motivates and energizes. Oxytocin, the bonding hormone that builds connection and trust. And serotonin, the stabilizer that keeps your mood steady. This release resets your nervous system. Emotionally, it can ease anxiety, lift your mood, and help you feel more grounded. That means less tension, less snapping at loved ones, less bottled up stress, and more day-to-day strength. Practically, daily release becomes like a natural reset button, not a cure-all, but a gentle, consistent support for mental health. Benefit number 2, better sleep quality. Have you ever noticed feeling heavy after sex or masturbation? Biologically, that's because of prolactin, a hormone that supports relaxation and sleep. Add that to the stress-reducing endorphins and oxytocin, and you've got a built-in sleep aid. For men who struggle with racing thoughts, stress, or even mild insomnia, this can mean falling asleep faster and staying asleep longer. Emotionally, it's about relief from restless nights. Practically, it means better recovery, sharper focus, and more energy the next day. Benefit number 3, improved blood flow and circulation. Orgasm isn't just a brain event, it's a full body workout. Biologically, during arousal, your blood vessels open up, your heart rate increases, and circulation rises everywhere. This vasodilation helps deliver oxygen and nutrients to your muscles, brain, and skin. Think of it like a mini workout for your vascular system. Emotionally, it boosts confidence by improving erection quality. Practically, it helps keep your cardiovascular system responsive and is an often overlooked part of men's health. Benefit number 4, lower risk of prostate cancer. This is one of the most powerful findings. Biologically, a major Harvard study following over 31,000 men for nearly 20 years found that men who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer. Why? The theory is that ejaculation helps clear out the prostate, removing old cells, inflammatory agents, and other buildups that could otherwise increase cancer risk. Emotionally, it offers reassurance about one of men's biggest health fears. Practically, it means sexual activity may play a role in protecting your prostate, though, of course, it's not a replacement for regular checkups. Benefit number 5, immune system support. Here's a bonus you may not have expected. Biologically, studies show that sexual arousal and orgasm can boost levels of immunoglobulin, one of your body's first-line defenses against viruses and bacteria. Combine that with lower stress, which itself strengthens immunity, and you get subtle but real immune support. Emotionally, that's peace of mind. Practically, it's another reason sexual health fits into overall wellness. Now, before I tell you about the risks, there's something you need to know, something most men never learn. The Harvard researchers didn't just find that frequent ejaculation helps, they found a magic number. Here's what the data shows. For 6 to 7 times per week, that's roughly 21 or more times per month, was linked to a 36% reduction in prostate cancer risk compared to men ejaculating less than 2 to 3 times per month. But here's the critical part. Most videos skip this. Frequency changes depending on your age. If you're in your 40s, 13 or more times per month offers the strongest protective effect, a 28% reduction in cancer risk. If you're in your 50s, the ideal drops slightly to around 10 or more times per month. Your testosterone is naturally declining about 1 to 2% per year, and your body needs more recovery time. And if you're in your 60s or beyond, even 4 to 8 times per month still offers significant benefit, because what matters isn't just frequency, it's consistency. So if you've been wondering, am I doing too much, too little? The answer depends entirely on where you are in life. For men in their 40s, 2 to 4 times per week is the sweet spot. For men in their 50s, 1 to 3 times per week balances benefit with energy. And for men 60 and older, 0 to 2 times per week is perfectly healthy. Remember this, it's not about hitting a number, it's about how you feel, your energy, your desire, your confidence. Now, with that context, let's talk about the 5 drawbacks you need to watch out for. Drawback number 1, compulsive behavior. There's a huge difference between a healthy habit and an unhealthy obsession. If you're choosing daily ejaculation consciously for pleasure, stress relief, or intimacy, that's one thing. But if you feel controlled by the urge, if it starts interfering with work, relationships, or focus, then it's moving into compulsive territory. Biologically, compulsive patterns can rewire your reward system. Emotionally, they create guilt and shame. Practically, they drain time, focus, and even intimacy with partners. The key question to ask yourself, am I choosing this or is it choosing me? Drawback number 2, using it as an emotional crutch. We all face stress, boredom, loneliness, or sadness. But if ejaculation becomes your only coping tool, it may be covering deeper emotional needs. Biologically, it creates a dependency on one pathway for relief. Emotionally, it can block real healing. Practically, it keeps men from building healthier outlets: exercise, journaling, connection, therapy. Ejaculation should be one tool, not the only tool. Drawback number 3, lower sperm count. If you're not trying to have kids, this isn't a concern. But if you are, daily ejaculation can lower sperm concentration. Biologically, sperm need time to refill, usually 48 to 72 hours. Emotionally, this can create stress for couples struggling with fertility. Practically, spacing out ejaculations every 2 to 3 days during conception efforts may improve chances. It's not about abstinence, it's about strategy. Drawback number 4, reduced sensitivity or desire. Ironically, too much of a good thing can dull your reward system. Daily ejaculation, especially when rushed or repetitive, can lower sensitivity or reduce spontaneous desire. Biologically, your brain adapts, weakening dopamine's punch. Emotionally, it can create a flat, unmotivated feeling. Practically, you may notice less arousal with your partner. Short breaks, even just a few days, can reset sensitivity and restore spark. Drawback number 5, performance issues. If rushed, if daily ejaculation happens through quick, hurried stimulation, your body learns speed over time. This can condition premature ejaculation or performance anxiety with a partner. Biologically, your nervous system adapts to sprint mode. Emotionally, it creates frustration for both partners. Practically, it hurts confidence in the bedroom. The fix? Slow down. Practice edging, breath control, or mindful stimulation. Train your body for rhythm, not just release. Now, if you're finding this helpful, if you're starting to see where you might need to adjust, do me a favor, hit that like button right now. It helps more men find this information. And drop a comment. What's one change you're going to make after watching this? I read every single one. So, what's the bottom line? Daily ejaculation isn't inherently good or bad. The key is to ask, why am I doing this? Stress relief? Pleasure? Intimacy? Or compulsion? How is it affecting me? Am I sleeping better? Feeling confident? Or noticing fatigue, flatness, or guilt? Does it fit my goals? If I'm trying to conceive, do I need to adjust frequency? Here's your practical protocol. Step 1, pay attention to your body. Track energy, mood, libido for 2 weeks. Step 2, experiment. Try daily, try spacing out. See what feels best. Step 3, balance. Make sexual release one tool in a larger wellness toolkit. Step 4, communicate with your partner if you have one. Never ignore changes in erection quality, pain, or prostate health. Those deserve medical evaluation. Let me tell you about Robert. He's 64. Came to my clinic feeling completely defeated. He told me, "Doc, I thought at my age things were just done." Robert had been ejaculating daily for years, out of habit, not desire. He felt drained, disconnected from his wife, and convinced his body was failing him. We made one simple change. We spaced it out to every 2 to 3 days. Within a month, his energy returned, his desire came back, and most importantly, he reconnected with his wife in ways he hadn't in years. Robert isn't an exception. I see this transformation constantly in men in their 50s, 60s, even 70s. If you felt shame, confusion, or even fear around this topic, you're not alone. Sexual health is part of human health. It doesn't make you weak, weird, or broken to ask these questions. In fact, it makes you wise, because the more you understand your body, the more freedom and dignity you gain in your daily life. So here's the truth. Ejaculating every day can be perfectly healthy, or it can signal habits that need a little balance. It's not about rules, it's about self-awareness. And here's the most empowering part. You have the power to adjust. Small changes, whether adding a break, slowing down, or using intimacy as connection instead of escape, can give you more energy, confidence, and control. Age is not the end of vitality. Whether you're 50, 60, or 70, your body can adapt, your health can improve, and your confidence can grow. So keep learning, keep listening to your body, and keep building the kind of life that gives you comfort, freedom, and strength. I'm Dr. Jodie Whittaker. Thank you for spending this time with me. If you found this video helpful, give it a like, subscribe for more men's health content each week, and drop your thoughts in the comments. I read them all, and this community means a lot to me. And remember, your body is worth understanding, your health is worth protecting, and your vitality is worth fighting for. Take care of yourself. You deserve it.